Hello everyone, this is Ronnie, and today we are going to talk about evidence-based dentistry. So, what is evidence-based dentistry? As ADA defined it, as evidence-based dentistry is an approach to oral healthcare decision making that requires the judicious integration of systematic assessments of clinically relevant scientific evidence relating to the patient's oral and medical condition and history, together with the dentist's clinical expertise and the patient's treatment needs and preferences. So, to summarize that, evidence based dentistry is a decision making process that balances different factors to come up with a balanced treatment plan and decision. As said in the definitions, the factors can be existing scientific evidences like researches and also studies. Um, it could um, it could also be a factor of the current patient's medical condition or oral conditions, and it also factors out the clinician's experience or the dental clinician's experience and expertise. And also, the important part is what the patient wanted for their treatment. So, here's a good example picture of how balanced of those four factors are for evidence-based dentistry. So we have the scientific evidence, patient preference, the clinical patient circumstances, and the judgment and experience of the clinician. And if you mix all those up, it would be a balance of treatment decision. So things to consider in the decision making process are those for the scientific evidence. The scientific evidence are the current researches that can improve or that can prove the effectiveness of a material. And then patient preferences. So it is very important to respect the patient's autonomy. And then experience and judgment of the clinician. So this is also an important factor. This is where a clinician does their own observation and application on what materials has a more success rate on the treatments they have been doing. So another factor is the clinical circumstances. It is also important to consider special variables that could make a treatment more challenging. So first, I have a theoretical clinical situation here, and a patient comes in the dental clinic with some toothache on a tooth that broke 2 years ago. Patient did not have the funding to get a crown done or filling and did some DIY or do-it-yourself dentistry with some thermoplastic craft material called Instamorph moldable plastic to fill the tooth for a year now. Then the patient said she replaces the material every 3 to 5 days. Patient asks you if it's okay to keep doing it and is the material safe, but it's your first time hearing about this material. So we do a PICO question. So P is for patient. Patient with pain and possibly needing restoration after resolving the pain or infection. Intervention. Patient intervention that was done was the DIY thermoplastic interim restorations, which the patient did for a year. Then comparison. So we are going to compare the DIY dentistry with thermoplastic as a filling versus comparing it to composite restoration done in a dental clinic. or a crown. Then the desired outcome. So the desired outcome for this is priority is getting the patient out of pain or resolve the infection if it exists. Then restore teeth with a material that would be more permanent and meeting patient expectations. So you ask the patient first what is the material that they used, and they showed you this as part of their research. It basic and they told you that it's a craft material that you put on hot water and mold it to a tooth or put it on the hole in your teeth. And also the patient researched Amazon reviews on how it worked. Patients stated that people are liking the results, but they had to replace it most of the time. And then you do your own research about that material or a thermoplastic material. And then you find an article which reviews all the thermoplastic materials. So the article you found stated that thermoplastic materials are an alternative to acrylics, and they started using it in the 1950s. Thermoplastic materials are composite copolymers that possess the quality of flexibility, but they are mainly used for dentures or denture materials. And then and you found out that there is no current research or studies that prove the success on usage of the thermoplastic as a dental filling alternative. Also, you researched that the manufacturer product intention was for crafting or making art stuff only. There's no current research or studies that would prove that it's a good material to use for dentistry or just for doing your own fillings at home. So how would you use the research gathered? So it would be a good educational tool for your patient. So first, tell your patient what your research findings are. And what your research finding was, there is no current research evidence that's going to prove the effectiveness or the success of using that plastic material as a restoration. And then you can also use this opportunity to educate your patients on the importance of using ADA approved materials or materials that was originally made for dentistry, like composite restorations, amalgam restorations, and crowns. And then after that, you can start applying evidence-based dentistry to come up with a treatment plan for your patient, minding the four factors of evidence-based dentistry. And to come up with that treatment plan, you have to consider the evidences. For this example, if you look for evidence for that thermoplastic, you could tell the patient that there is no scientific evidence, so that would not count. But you can tell the patient that crowns and composite materials have higher success rate and has scientific evidences. And then you can talk about patient preferences and since the patient stated that they had some money issues from the past, maybe you could work it out on doing a filling instead of a crown if needed, and other circumstances. And also your experience and judgment is a big thing there, which you will judge the material that will be used if it's appropriate for that situation. And that would be my presentation. Thank you.